anybody with any brain-based issues can get something out of this. Even people that don't have any concerns might get something out of this, such as knowing that they're not sleeping well at night, that they're having sleep apnea, or that they're rolling around a lot and they're not getting enough oxygen. That'll show up on the brainwave as well. It can tell you that there's brain fog or anxiety. For people who have ADHD or depression or anxiety, bipolar disorder, any of those types of things, concerns about dementia or Alzheimer's, you can know 25 or 30 years before you ever have a symptom that's coming, and you can stave it off, right? You can do different treatments to make sure you never get that, right? So some people just want to know for sure, maybe their grandpa had it and they're concerned, they can see whether or not that's something that they need to be concerned about for themselves. For people who want athletes and people who want peak performance, right? You want to be your best self, and you're already thriving, you're already doing well, health-wise you're in good condition, right? Maybe you need extra information to make sure that you can get your optimal performance, right? So you don't really know unless you look, right? So there's a lot of people who get into athletics or bodybuilding or weightlifting, whatever it is, track, right? A lot of people who get into these types of things because they have ADHD, or they maybe don't have full ADHD, but they have elements and symptomology in their brain going on. It's not true ADHD, but maybe there was a brain injury or concussion, or maybe there's like lack of blood flow in a certain area, things like that. So you're trying to keep your brain online and keep stimulation going a lot, and you tend to go toward things like athletics to be able to get that stimulation, and it feels good to you, so you tend to do that more, right? So there's a lot of people who are in that upper echelon of athletics or weight training or bodybuilding, or people that are on the front lines of like what are the other new wellness and health options out there for me and modalities out there for me. For many of those people, they don't think about doing something like this because they may not have an injury, they may not know about any injuries or things like that. But if you're looking for peak performance, this can tell you whether or not you have a low amount of electricity or energy in certain areas of your brain or too high in other areas.
Now, we have a lot of equestrians here in Ocala.
Yeah.
Obviously, we fall off of our horses. We also have a lot of mountain bikers. If you have hit your head in the past, how important would it be to actually do this test?
Extremely, because you don't know if it has healed all the way. Even if it's healed most of the way, any sort of older damage can cause symptomology that you're not aware of. And so I have a friend who, she had a concussion when she was a little child. She didn't have any symptomology until she was like 40-ish. And then she started getting brain fog, and her learning was slower, and she was getting headaches, and she was like, I don't know why, I'm frustrated all the time. So she started having these issues, and we just happened to do her EEG just on a whim because she didn't have anything major going on. She just was like, yeah, let's try it. So we tried it out, and we found out that there was a huge area that wasn't getting any blood flow, and this was has arranged the energy flow in her entire brain to be different than it should be. And so she needed treatments, and heavy treatments actually, that we wouldn't have ever known unless we looked under the hood, So yeah, if you have any sort of damage, if it's closer to the point of damage, right? If it just happened and you come in a week later or a month later, it's much better, more beneficial for you. You can get a lot more recovery that way. If it's something that's really, really old though, and you're a child, or let's say you fell off your horse when you were 20 and now you're 60, well, you still have reparative options, right? You can still go in and see where the damage is, what's happened there, and rebalance the brain waves, and increase the blood flow and oxygenation in the areas that have been damaged. For the most part, there are some times where you have an injury that you can't get all the way there, but you can recover and reduce a lot of symptomology that you might be having.
So also with stroke patients, they would benefit from doing this regardless of how old the stroke was?
Absolutely. Even for people that have already have dementia or Alzheimer's, you can reduce symptomology, and you can gain a greater level of functioning for a longer period of time. or children with ADHD or autism or ODD, like any of the issues that you might
on the
have
spectrum.
any spectrum issues.
What about learning disabilities?
Absolutely.
Yeah.
Same thing. You don't have to necessarily have to have a diagnosis of some kind.
But if you suspect that something is going on, it might be a good option for parents to bring their kids in to get evaluated.
Yes.
And then come up with a treatment plan after that.
Right.
How long after doing the initial test does it take before we'll start to see changes in the brain patterns? And how frequently should we actually be doing this if we want to use this?
It depends on what your treatment plan is. If you're hitting hard on all of the treatments and you're doing everything that's been recommended of you, you should see fairly quickly. The typical treatments might be 2 to 3 times a week, depending. So you could be referred to do neurofeedback or biofeedback or neurostimulation. You could be referred to do just breath work. It could be like more cardio. It could be working on your sleep patterns, sleeping more. Could be nutritional supports or a lot of stress related. It really depends on what is the outcome of the issue. So if you had just anxiety, for instance, so anxiety, we can work on anxiety and do just 3 or 4 days worth of different treatments, and you'll see pretty immediate changes. Yeah.
So, and for you, would you say like every 3 months somebody should do this, or it should be shorter, like once a month kind of deal? If
we're doing an ongoing treatment plan, the average would be that you would have whatever treatments were recommended for you, and then if you're keeping on course with that, you'd want to do another brain mapping every 3 to 6 months.
Okay.
Right, depending on what you're working with.
Right.
Some people choose to just do it one time just to get the initial assessment, and they can feel and see the difference of whatever treatments we're doing. So they're like, oh, it's not necessary to really do that part. Unless there's some other event, like you had a car accident, you might have hit your head, and you want to double check, right? Usually people have the symptom reduction and they feel it. They feel their sleep is better, they see even their stride could be better, they have better balance, right? Like there's just things that are, even for top athletes, right? They think they're at their peak game, but if you can tweak just a little thing here or there and you see the difference and you feel the difference, maybe you're catching the ball quicker, or your ability to react is better, or your balance is better, or just your thinking is sharper.
Yeah.
Right?
All right. Perfect. Thanks.